Taking a look at the latest numbers, the Illinois Department of Health is reporting nearly 12,000 new confirmed and probable COVID-19 cases here. Also troubling, there were 127 new deaths. It's the fourth straight day the COVID death toll in the state has surpassed 100. That has not happened since May. The new COVID numbers show an increase in those who have to be hospitalized, is putting a new round of stress on the healthcare system. CBS 2's Jeremy Ross is live outside Northwestern Hospital with a closer look at what the COVID numbers mean for hospitals. Jeremy?
And Jim, those numbers up throughout the state. A doctor we spoke with calling this a new round of crisis, not only for patients, but for those working in hospitals.
The numbers we have now are much higher than the numbers we had back in the spring. And with the numbers as they're climbing, the cases, we can only expect for the near term that these are going to continue to go up.
How worried are you?
I'm very worried. Our whole health system is worried. The patients are coming in more frequent and sicker, and it's not slowing down. So we just have to continue to try and manage the patients. We have not enough staff sometimes to staff the beds that we have.
Dr. Ernest Wong, Chief of Emergency Medicine at North Shore University Health Systems, oversees 5 hospitals, including in Evanston and Highland Park. He says they are not turning away patients who come in for emergency care, like car crashes or heart troubles, but COVID-19 is stressing their staffing to the breaking point. The state of Illinois reporting more than 6,100 in hospitals with COVID-19, nearly 600 on ventilators, but that is up significantly from only 2 weeks ago. In that time, there's been a 45% increase statewide in COVID-19 hospitalizations and a 62% increase of the sickest patients with the virus on ventilators. Wong says the bulk of his patients aren't in that most critical group yet, but
the number of people requiring oxygen is astounding, and not quite ICU, but certainly not well enough to send home is a big proportion of the current patients that we're seeing.
so scary numbers now, and you're just bracing for what comes after Thanksgiving.
Absolutely. But we're going to be here. We're going to be here.
The doctor extremely concerned the upcoming holiday will in fact double as a super spreader event for the virus. He says the best way to avoid hospitalization going forward is to simply do this, and that is wear a mask to protect yourself, your family, and to put stress off of those healthcare workers working in the hospital. Live outside Northwestern Memorial Hospital, Jeremy Ross, CBS 2 News.